Hello, class. My name is Crystal again. I'm here to discuss a critical situation with a 19-year-old female patient presenting with symptoms of postpartum psychosis. I'm going to assess my steps after the case study. I'm going to assess the patient. I'm going to use a mood diagnosis tool of the mood disorder questionnaire. This is to identify what type of mood disorder the patient is having. So after questioning the patient, I found the patient is exhibiting postpartum psychosis. So these are the symptoms that the patient is exhibiting. The patient has a rapid, loud, and tangential speed. She's delusional and belief about her baby being an alien. She plans to take the baby to the desert for retrieval, and she recently changes in behavior and appearance. She denies homicidal ideation, but husband expresses some concern. Those are the immediate action I'm planning to take. I'm going to first to ensure the safety of the baby. I'm going to separate the baby from mother temporarily, and I'm going to um, give the baby to the husband or a trusted family member. So after that, I'm going to collaborate with the pediatrician for the infant support. So also, I'm going to enforce the emergency psychiatric evaluation for the patient. I'm going to contact the crisis hotline for emergency services. I'm going to arrange hospitalization if necessary for the patient's safety. I'm going to consider involuntary commitment if patient refuses treatment. So if necessary, I'm going to notify some authorities such as CPS. So I'm going to also uh, notify the law enforcement if patient poses some threat to herself or others. To stabilize the patient, the next step is going to be medication. I'm going to use antipsychotics medicine such as risperidone between 2 and 4 milligrams a day. Also, I will use Seroquel between 240 milligrams a day. So after using the psychotic medicine, I'm going to look at the mood stabilizer. So I'm going to look at the valproic acid I will start with 500 milligrams a day. And I'm going to also give lithium for the suicidal thought and it's going to be between 600 and 1200, but I will start with the lowest dose, 600 milligrams a day. Another therapy medication I would use will be benzodiazepine. For anxiety, I'm going to use lorazepam or clonazepam. So let's move on now. The next step regarding the non-pharmacology treatment. I'll refer the patient to therapy, psychotherapy, the cognitive behavior therapy for psychosis. So I'm going to also refer the patient I'm going to consider family therapy for support network involvement. And I'm also going to consider individual therapy for patients' emotional regulation. So talk about follow-up. So I'm going to have a close monitoring with the patient. The patient will have a regular appointment every 1 to 2 weeks, and we'll have some fun check-ins between appointments. The treatment will be, we have to do some treatment adjustment. So medication adjustment will be done as needed. Additional therapy such as group therapy can also be done if needed. So I'm going to consider the follow-up for the infant safety. I'm going to check with the CPS. I'm going to make a regular check-ins with the CPS, and I'm going to collaborate with pediatrician for the infant well-being. So another additional consideration. So I will look at the postpartum psychosis risk factors. I'm going to look at the family history of the mental health condition. I will ask the patient about the family history. So I'll ask patient about the previous traumatic experience and so the history of substance abuse. I'll look into the cultural sensitivity. I'm going to consider influences on patients' belief. I'm going to consider cultural influences on patients' belief. Adapt treatment plan accordingly. So I'm going to adapt treatment according to the patient's cultural beliefs. So I'll look into the collaborative care. So I will work with the obstetrician and pediatrician for comprehensive care, and I'm going to consider consulting a perinatal psychiatric. In conclusion, postpartum psychosis requires swift action to ensure infant and maternal safety. Thank you.